Hi, hello friends, good morning. Welcome to my channel, The Voice of Nurse. Today we are going to discuss midwifery and gynecological nursing point of view, questions and answers with explanation, the continuation topic. This is part 3. Already we discussed part 1 and part 2 from the question number first question to 30 question part 1 and the part 2 30 to 60 we already discussed. Today we will discuss the continuation questions from 70 to 100 questions, 40 questions we will cover in this video. Before moving on to topic, a small request friends. Those who are watching first time my channel, please subscribe my channel, click on the bell icon for further notification. Let's move on to topic. We will discuss now questions. The 61st question is Cystocele is a. We will see the options here. Option A, appearance of part the urinary bladder in the anus. Option B, appearance of part of the bladder in the urethra. Option C, appearance of part of bladder in the vagina. Option D, none of the above. Here, what is cystocele? Cystocele is a bulge of the bladder into the vagina. Cystocele also called as bladder hernia. A cystocele can result from the childbirth due to the constipation and at the childbirth time, post-op period, heavy lifting or other pelvic muscle strain. Due to these causes, cystocele will happen. The factors that increases your risk of cystocele are childbirth, age, obesity and also chronic constipation. These all are the risk factors. And here cystocele is a appearance of part of urinary bladder in the vagina. So here option C is the correct answer. Cystocele is a appearance of part of bladder in the vagina. Here we can see cystocele prolapse. Here you can see the cystocele in this picture. Okay friends, next we will move on to question number 62. Ischial tuberosity helps for. Ischial tuberosity helps for. Ischial tuberosity is present in pelvis. We will see the options here. Option A, normal labor. Option B, normal walking. Option C, normal standing. Option D, bearing of body weight while sitting. Here ischial tuberosity helps for bearing of body weight while sitting. Ischial tuberosity is the lower part of the pelvis that sometimes referred to sit bone also. Some of the times it is called as sit bone also. It helps bearing of body weight while sitting. It is also known as sitting bone also. Here ischial tuberosity helps for option D, bearing of body weight while sitting. Here we can see in this pic, here in this picture we can see here the pelvic bone. The green color portion is called as ischial tuberosity. While this portion means the ischial tuberosity only we are sitting, bearing of body weight and also while sitting. This helps to bearing of body weight and while sitting the ischial tuberosity helps to us. Move forward. Next question number 63. The forceps applied for the occipito-lateral or occipito-posterior position is. The forceps applied for the occipito-lateral and or occipito-posterior means during the labor period. We will see the options here. Option A, Keyland's forceps. Option B, Reglis forceps. Option C, Burney's forceps. And option D, none of the above. Here, during the period of labor, the forceps we are using in labor, Keyland forceps, option A is the correct answer. Keyland forceps is used for rotational assisted vaginal delivery and remaining controversial. The overall length of this product is 350 mm. 350 mm the length of the Keyland forceps. Here we can see in this picture the Keyland forceps. Keyland forceps is having two blades, one lock, one stroke and two handles. this is the keel and forceps. With this keel and forceps only we can rotational assisted for the vaginal delivery during the period of labor. Okay friends, next move on to question number 64. The 64th question. Neonate of diabetic mother is at risk for all of the following except. From the following, the neonate of diabetic mother risk for the neonate except the condition from the following options. You will see the options here. Option A, hypoglycemia. Option B, hypokalemia. Option C, hyperglycemia. And option D, hyperbilirubinemia. If it in case of neonatal complication in infant born to diabetic mother, the baby was screened for hypoglycemia and hyperglycemia. If it is baby is having hyper and hypoglycemia, we have to check. And also hyperbilirubinemia means we have to check the bilirubin levels also. But here except the option, the neonate baby means neonate diabetic mother risk for the except condition option B, hypocalcemia. Hypocalcemia means low level of the calcium, means decreased level of the calcium in the blood. But in diabetic cases there is no changes in calcium. So here the except condition is hypocalcemia. Next move on to question number 65. When umbilical cord is inserted at the edge of the placenta is termed. This is abnormal condition. We will see the options here. Option A, central insertion. Option B, battledore insertion. Option C, velamentous insertion. And option D, lateral insertion. The umbilical cord inserted edge of the placenta is termed velamentous insertion. This is one of the abnormal condition of the pregnancy. The velamentous cord insertion is pregnancy complication that happens when umbilical cord from fetus does not insert into the placenta correctly. The umbilical cord is inserted in the fetal membrane. Friends, here the umbilical cord is inserted into the fetal membrane also. This is the velamentous insertion. Here we can see the velamentous insertion in this picture. This picture is not visible now. I will show you in bigger size. Here we can see the normal cord insertion in first picture, the velamentous cord insertion in second picture. In normal cord insertion, umbilical cord is in the correct position in normal cord insertion. Here velamentous cord insertion, we can see the exposed blood vessels. That cord is inserted in the fetal membrane also in this second picture, velamentous insertion. Here option C is the correct answer. Next, move on to question number 66. To test the RH incompatibility, the following test can be carried out. How to identify RH incompatibility? Through the test from the following options. We will see here options. Option A, HB hemoglobin. Option B, chest X-ray. Option C, CT scan. And option D, Coombs test. Here option D, Coombs test is correct answer. Through the Coombs test we can identify the RH incompatibility of mother or any person. The Coombs test is having two types, direct and indirect Coombs test. In indirect Coombs test is given to every pregnant person to see there is any abnormalities in the antibodies against the RH positive blood. Here the direct and indirect Coombs test. We will see direct Coombs test additionally here, performed by adding anti-human globulin to the patient RBCs. Here in direct Coombs test performed by adding anti-human globulin into the patient RBCs. Next we will see indirect Coombs test. In indirect Coombs test performed by adding patient plasma to test RBCs followed by addition of anti-human globulin. Anti-human globulin also they will add in indirect Coombs test. Here the test RH incompatibility, option D is the correct answer, Coombs test. Here we can see in this picture the direct and indirect types, the direct and indirect Combs test in this picture. Next, move on to question number 67. Uniovular. The uniovular twins may have options. Option A, 2 amniotic sac, 1 placenta and 1 chorion. Option B, 2 placenta, 1 amniotic sac and 1 chorion. Option C, 1 placenta, 1 amniotic sac, 2 chorions. And option D, none of the above. Before discussion, we have to know uniovular twins. What is the meaning of uniovular twins? The uniovular twins develop from a single ovum with after fertilization. Okay friends, uniovular twins means developed from a single ovum which after fertilization by a single sperm has undergone division to form a two embryos. The twins are the same sex, same similar physical similarities in physical and mental characteristics as well as same blood group, but no fingerprints are same. Clear friends? I will explain again. The uniovular twins developed from a single ovum which after fertilization by a single sperm has undergone division to the two embryos. These twin babies and these twins are having same sex, same similarities related to the physical and mental characteristics and as well as same blood group, but not fingerprints are same. Here additionally I will explain bino-ovular twins. What is bino-ovular twins? Bino-ovular twins, these are twins that develop from the separate ova that were fertilized at the same time. This is the normally we can see, but uniovular twins are rare. Here uniovular twins may have option A, 2 amniotic sac, 1 placenta and 1 chorion. Here we can see in this picture. Actually this picture is not visible. I will show you in bigger size. In this picture we can see here 2 amniotic sacs and 1 placenta and 1 chorion. This is called as uniovular twins. Next, move on to question number 68. Ova have the fertilization capacity up to. Ovum is having the fertilization capacity up to. We will see the options here. Option A, 10 hours after ovulation. Option B, 48 hours after ovulation. Option C, 24 hours after ovulation. And option D, 12 hours after the ovulation. The ovulation is when an egg is released from an ovary. Ovulation period lasts for 12 to 48 hours. Here option B is the correct answer. Ova have the fertilization capacity up to the 48 hours of after ovulation. Here option B is the correct answer. Next, move on to question number 69. After the delivery, the bulky uterus indicates. Here after the delivery, the uterus is bulky. That indicates to. We will see options here. Option A, presence of anemia. Option B, presence of infection. Option C, presence of blood clots. And option D, all of the above. The after the delivery, bulky uterus is indicates to presence of blood clots in the uterus. Here option C is the correct answer. Several common conditions can cause a bulky uterus. Includes the fibroids, ovarian cyst, adenomyosis and PCOD. Polycystic ovarian disease and also polycystic ovarian symptoms. Also one of the causes of bulky uterus. Menopause and endometrial cancer also causes for the bulky uterus. The bulky uterus indicates here option C, presence of blood clots in the uterus. Here we can see in this picture the bulky uterus. First the uterus picture is normal, but the second picture is bulky uterus. We can see here some of the dots on the uterus. This is the bulky uterus. The fibroids are present in the uterus. This is called as bulky uterus. Next, move on to question number 70. Magnesium sulphate is the drug of choice for MgSO4 is the drug of choice for following options. We will see here option A, Impaired renal failure, option B. Myasthenia gravis, option C. Eclampsia, and option D. Respiratory failure. Magnesium sulphate is most commonly used to treatment for eclampsia. The treatment of eclampsia and patient with severe preeclampsia symptoms and usually given by either IM or IV route. Magnesium sulphate is drug of choice for eclampsia. Option C is the correct answer here. Next, move on to question number 71. MC Burney point is located in which quadrant of abdomen? MC Burney point is located in which of the quadrant of the abdomen? We will see options. Option A left upper, option B right lower, option C left lower, and option D right lower. Here MC Burney point is the name given the point over the right side of the abdomen, that is 1/3 of the anterior superior iliac spine to the umbilicus. It is most common location to base of the appendix where it is attached to the caesium. Here option B right lower is the point is located for the quadrant of abdomen MC Burney point. Here option B right lower is the correct quadrant of the abdomen MC Burney point. Next, move on to question number 72. During pregnancy, deficiency of which of the following leads to neural tube defects? During the pregnancy, deficiency of which of the following options that leads to neural tube defects? We will see options here. Option A calcium, option B malnutrition, option C iron, and option D folic acid. Here NTD neural tube defects. The deficiency of folic acid is leads to neural tube defects. Here option D is the correct answer. Folate or folic acid are important for pregnancy. Through the sufficient of folic acid with intake, we can prevent the birth defects. The neural tube defects NTD neural tube defects are two types, spina bifida and anencephaly. Spina bifida means related to the spinal cord defects and anencephaly means defect to the brain. Here option D folic acid deficiency leads to neural tube defect. Here we can see the baby with neural tube defects, anencephaly and also spinal cord defects is spina bifida due to the folic acid deficiency. Move on to question number 73. Blood sample must be drawn between the weeks of MSAFB. What is MSAFB? Maternal serum alpha fetoprotein is called as MSAFB. Blood sample must be drawn between the which weeks of pregnancy? The blood sample is MSAFB. We will see the options here. Option A 15 to 24 weeks, option B 15 to 20 weeks, option C 12 to 20 weeks, and option D 12 to 24 weeks. AFB, a protein normally produced by a fetus between the 15 to 20 weeks. AFB levels usually range between 10 Ng for ml to 150 Ng for ml. What is Ng? Ng means nanograms. 10 nanograms for millimeter to 150 nanograms for milliliter. The normal between the range of the MSAFB is 0 nanograms for ml to 40 nanograms. Here the option B 15 to 20 weeks. Blood sample must be drawn between the weeks of 15 to 20 weeks. Here option B is the correct answer. Greater than 400 nanograms per milliliter could be sign of a liver tumors and abnormality of the baby. Here greater than 400 nanograms per ml is a sign of liver tumor. Finally, I will explain one more thing. MSAFB. Why we have to do this test? MSAFB to identify the birth defects related to the tumors and any abnormalities to the baby, and especially in the liver point of view, we can identify abnormalities in the fetus. This is the MSAFB. Option B is the correct answer here. 15 to 20 weeks of the time we can draw the blood sample from the mother. Next, move on to question number 74. Operculum means Operculum means options. Option A, mucoid discharge. Option B, blood discharge. Option C, pus discharge. And option D, water discharge. Operculum is a mucoid discharge. The enlarged mucous glands of the cervix during the pregnancy secrete a mucus which forms a plug is called as operculum. Here in this picture we can see the mucus plug in the uterus, cervix, vagina. Upper portion is cervix, upper position is the mucus plug is formed. The mucus plug is called as operculum. Here option A, mucoid discharge is called as operculum. Next move on to question number 75. FHR is visible approximately. FHR means fetal heart rate. Fetal heart rate visible approximately in the weeks from the following. Option A, 10 weeks. Option B, 5 weeks. Option C, 6 weeks. And option D, 7 weeks. Here FHR, fetal heart rate monitoring, measures the heart rate and rhythm of your baby, means the fetus. Average FHR between the 110 to 160 beats per minute and FHR visible around the 6 weeks. Option C here correct answer. FHR visible approximately 6 weeks of the pregnancy during the pregnancy time. Option C is the correct answer, 6 weeks. Next move on to question number 76. During pregnancy, the diaphragm is displaced by options. Option A, 2 centimeters. Option B, 1 centimeter. Option C, 3 centimeters. And option D, 4 centimeters. During the pregnancy, the diaphragm is displaced by 4 centimeters. Diaphragm moves 5 centimeters upward with the increasing uterus size and chest increases the size during the pregnancy. It is approximately 4 centimeters. Option D is the correct answer. Diaphragm is displaced by during the pregnancy time 4 centimeters. Next move on to question number 77. During episiotomy, the following nerve is blocked due to prevent pain. We will see the options here. Option A, sciatic nerve. Option B, femoral nerve. Option C, pudendal nerve. Option D, none of the above. During the episiotomy, following nerve is blocked to prevent the pain. Means during the episiotomy, local anesthesia was done. Means local anesthesia was done. Due to the local anesthesia, the pudendal nerve blocks to prevent pain. Here option C is the correct answer. We will see the additionally pudendal nerve blocks in which the local anesthetic is administered around the parasympathetic fibers of the pudendal nerve from the vagina and the perineum. Here episiotomy during the episiotomy, nerve blocked to prevent the pain is pudendal nerve. Option C is the correct answer. Next we will see next question. Question number 78. The levator and muscles are present. We will see the options here. Option A, present in the pelvic floor. Option B, perforated by 3 canals. Option C, most substernal of 6 pairs. Option D, acts like a sling in the pelvic floor. The levator muscles are present in the pelvis. Here option E is the correct answer, all of the above. The levator muscles and levator ani muscles are present in the pelvic floor, and is muscles are performed by a 3 canals and also most substantial of the 6 pairs and acts like a sling of the pelvic floor. Is these all are the correct answer, means the levator muscles. This option A, B, C, D is the correct answer. And additionally I will explain, levator ani muscles is the largest component of the pelvic floor, situated either side of the pelvis. You can see in this picture pelvis. In this picture the orange colored portion is called as levator muscles, levator ani muscles. Next move on to question number 79. Takes place at which of the period of labor? We will see the options here. Option A, 2 to 3 days of before labor. Option B, 6 days before the labor. Option C, 2 to 3 weeks of before the onset of labor. And option D, none of the above. Here what is the lightening? End of the third trimester, the baby settles or drops lower into the mother pelvis is called as lightening. Yes, yet 2 to 3 weeks before onset of the labor. Option C here, correct answer, lightening takes place 2 to 3 weeks before onset of the labor. Next, move on to question number 18. We will see the options here. Option A, marks of veins. Option B, marks of pregnancy. Option C, marks of burns. Option D, marks of keloid. What is chloasma? Chloasma is a condition which brown patches appears on the face. It is also called as melasma also. Chloasma also called as melasma. A condition which brown patches appears on the face is called as chloasma. It can be due to the hormonal changes during the pregnancy or sun exposure. Here option B, marks of the pregnancy is called as chloasma. Option B is the correct answer. Here we can see in this picture the brown color patches appears on the face. This is called as chloasma or melasma. Next, move on to question number 81. Lochia is the vaginal discharge for first fortnight during puerperium which originates from. Means lochia is vaginal discharge first fortnight during the puerperium originates from the which of the following options? Option A, uterine body. Option B, cervix. Option C, vagina. And option D, all of the above. Lochia is postpartum vaginal discharge that comes from the cervix and uterus and vagina. Here option D is the correct answer, all of the above. Lochia is the vaginal discharge first fortnight during the puerperium. The originates from the all of the above. Correct answer option D. Next, move on to question number 82. A client in her third trimester tells nurse, I am constipated all the time. Which of the following should the nurse recommend? We will see the options. Option A, laxatives. Option B, avoid fiber diet. Option C, increase fiber diet. And option D, none of the above. Here, client, her third trimester tells nurse, I am constipated. As a nurse, role of the nurse recommends to the client. Option C, increase the fiber diet. Additionally, we will discuss during the third trimester, the enlarging uterus places pressure on the intestine. Increasing the fiber diet will help fecal matter pass more quickly through the intestinal tract and encourage more liquid also. As a nurse, we have to encourage more liquids intake and fiber diet. Here, option C, increase fiber diet is the correct answer. Next, move on to question number 83. Endometrial biopsy for infertility is taken on which day? Endometrial biopsy during the infertility period, when we have to collect that sample. We will see the options here. Option A, 5th to 7th day. Option B, 12th to 14th day. Option C, 23rd to 26th day. Option D, 9th to 11th day. What is endometrial biopsy? Endometrial biopsy is sample obtained from the endometrium and then observed under a microscope. From the endometrium, we have to collect or remove cells from the endometrium. We have to send for the laboratory a microscope. Endometrial biopsy test usually done around 4 days prior to the menstruation. Means 23rd to 26th day is the correct answer, option C. In a woman with a 28 days of menstrual cycle is there, it is usually scheduled for days 24th to 26th day. Here before prior of 4 days means 23rd to 26th. Option C is the correct answer. Here we can see in this picture endometrial biopsy. Here we can see the catheter inserted into the endometrium. This is the procedure. Here option C, 23rd to 26th day is the correct time for the taking endometrial biopsy. Next, move on to question number 84. ARM is a contraindicated. We will see the options here. Option A, in pregnancy beyond 40 weeks. Option B, when the mother is Rh negative. Option C, when mother is diabetic. Option D, when the fetus is dead. What is ARM? ARM means artificial rupture of membranes. Nothing is there. Artificial rupture of membranes is contraindicated from the following options. ARM, artificial rupture of membranes used when baby dies. While still in the womb, doctors may deliver the baby by giving medicine to start labor, or DING. Dilatation and evacuation is one of the procedural in the during the labor. Here ARM, artificial rupture of membranes, contraindicated when the fetus is dead. Option D is the correct answer here. Next, move on to question number 85. HIV can be detected at antenatal clinic by, we will see the options here. Option A, ELISA test. Option B, Schick test. Option C, Combs test. And option D, all of the above. HIV can be detected in antenatal period. Is ELISA screening test is often performed for a pregnant woman in the antenatal period to prevent HIV transmission from the mother to baby during the pregnancy time and during the delivery time and the breastfeeding time also. Here HIV can be detected through the ELISA test. The window period of ELISA test is 4 weeks to 3 months. Here the HIV detected antenatal clinic, option A, ELISA test is the correct answer. Next, move on to question number 86. After which month the bladder dilates? We will see the options. Option A, 3rd month. Option B, 2nd month. Option C, 1st month. And option D, 4th month. This can happen. The dilatation of the bladder can happen while the baby is still in the mother's uterus because baby buildup of urine at 20 weeks of gestational age. Here option D, the bladder dilates at the period of approximately not exact 4th month of the pregnancy period. Option D is the correct answer here. Next, move on to question number 87. Stria gravidarum is caused by. What is stria gravidum? Stria gravidarum is the stretch marks over the stomach during the pregnancy is called as stria gravidarum. What is the causes of stria gravidarum? We will see the options here. Option A, adrenocorticosteroids. Option B, corticosteroids. Option C, basal corticosteroids. And option D, all corticosteroids. Here stria gravidarum occurs approximately 50 to 90% of pregnant women caused by some of the hormone changes like estrogen, relaxin and adrenocortical hormones. Adrenocortical hormones. Here option A, adrenocorticosteroids is the correct answer. Adrenocorticosteroids caused the stria gravidarum. The stria gravidarum. Here we can see in this picture the stretch marks over the stomach during the pregnancy. Next, move on to question number 88. By which week the serum levels of IgG, IgA, IgM increases? Immunoglobulin G, immunoglobulin A, immunoglobulin M increases at the which week? We will see the options here. Option A, 20 week. Option B, 15th week. Option C, 10th week. And option D, 5th week. Gradually decreases during the pregnancy. The serum levels of IgG, IgA, IgM will decreases during pregnancy but increased markedly during the 5th and 6th month following the delivery. Here option B is the correct answer. 15th week of time serum levels IgG, IgA, IgM increases. Additionally, I will make a one point here. IgG and IgM increases means not risk of transmitted of infection to the fetus. Here option B is the correct answer. 15th week the serum levels of IgG, IgA, IgM increases. Next, move on to question number 89. Bishop scoring is based on all seen in options. Option A, dilatation of cervix. Option B, effacement of cervix. Option C, uterine contractions. Option D, station of head. Here, what is Bishop score? Bishop score is a calculation used to predict how close patient is labor. Here, the option C is the correct answer, uterine contraction. Bishop score based on changes of the cervix and position of the baby head. And also, Bishop score is 10 to 13. Actually, 10 to 13 is there. Bishop score is 8 or high means labor spontaneously on client own and there is a chances successful vaginal birth. Score is 8 or high means that spontaneous delivery will happen and the successful vaginal delivery for the chances. Here Bishop score based on uterine contractions we can see. Here we can see the Bishop scoring chart. Score dilatation of the cervix, position of the cervix, effacement and station, cervical consistency. These all are the columns. According to cervical dilatation, position of the cervix, effacement, station, cervical consistency, we will give the score. 10 to 13 is the actual score, but 8 or high means that spontaneous delivery will happen with the vaginal birth, successful vaginal birth. Here this is the chart of Bishop scoring. Next we will see the question number 90. Primary infertility first test. The primary infertility first test is from the following options. Option A, wife's endometrial biopsy. Option B, wife's ultrasonography. Option C, semen analysis. And option D, husband's VDRL. Here the sperm viability testing is used to determine non-motile sperm or alive or dead sperm, to determine the sperm production and count any abnormal sperm functions. Here option C, semen analysis is a primary infertility test for the infertility. Semen analysis also called as male fertility test. Here option C is the correct answer. Semen analysis is primary infertility test in males. Here we can see the infertility test. Physical examination to be done first, then semen analysis, and also hormonal analysis also one of the infertility test. Here option C is the correct answer, semen analysis. Next move on to question number 91. Key elements of informed consent. What are the elements of informed consent from the following options? Option A, use of language that is understood. Option B, based information. Option C, risk and benefits of each proposed action. And option D, all of the above. Valid informed consent for research must include the three major elements. These are risk and benefits of each proposed action to be explained and voluntary nature of the decision taking, the process of informed consent and communication between the healthcare provider and patient and family members of the patient. Here option C, risk and benefits each proposed action to be explained to the patient and patient attenders or family members in the consent. Here option C is the correct answer. Next move on to question number 92. What is the hyperemesis gravidarum? Hyperemesis gravidarum means, we will see the options here. Option A, vomitings during pregnancy. Option B, allergic reaction. Option C, constipation during pregnancy. Option D, all of the above. In question only is their answer. Emesis means vomitings. Hyperemesis gravidarum means the severe vomitings during the pregnancy time. Here option A is the correct answer. Option A. Hyperemesis gravidarum is a more common in primary gravida mothers and first trimester due to the increasing the HCG, human chorionic hypertrophy. Means human chorionic gonadotropins is high means during hyperemesis gravidarum. During the period of first trimester, it is the more will happen. Severe type of vomiting during pregnancy. Option A is the correct answer. Next move on to question number 93. From the following, which is the except condition of mole presentations? Options. Option A, breast presentation. Option B, compound presentation. Option C, unstable lie. And option D, non-flex breech. What is the mole presentation? Mole presentation means relationship between fetal head and pelvic is called as mole presentation. And mainly we can see the mole presentations are compound presentation, unstable lie, breech presentation, and face presentation, brow presentation, and also transverse presentation. These all are the comes under the mole presentation. Here breech presentation is mole presentation, and compound and unstable lie, these also mole presentation. But here option D, non-flexed breech is a except condition in the mole presentation. Here we can see some of the mole presentation, the vertex presentation and breech presentation and shoulder presentation. These all are the mole presentations in the pregnancy. Next, move on to question number 94. International Anesthesia Day. Options: option A 15th September, option B 16th October, option C 26th November and option D 18th June. The founder of modern anesthesia is William T.G. Morton in 1918 to 1968. Modern anesthesia began in earnest on 16th October 1846 with a young Boston dentist name is Williams. Here option B, October 16th, International Anesthesia Day we are celebrating. Here option B is the correct answer. Next, move on to question number 95. Abnormal labor is known as. What is the abnormal labor? We will see the options here. Eustosia, option B. Dystocia, option C. Viability and option D. None of the above. What is abnormal labor? Any deviation from the normal labor is called as abnormal labor or dystocia. Option B is the correct answer here. The abnormal labor causes are placental and extraplacental and unexplained causes here. The dystocia is medical term abnormal labor. Ystopsia, option A. Eustocia means normal labor. Option B, dystocia means abnormal labor. The abnormal labor is causes means placental and extraplacental and unexplained causes. The dystocia is 60 to 70% now it is occurring. Next, move on to question number 96. Oligohydramnios means. What is the meaning of oligohydramnios? We will see the options here. Option A, amniotic fluid less than 200 ml. Option B, amniotic fluid less than 500 ml. Option C, amniotic fluid more than 1500 ml. Option D, amniotic fluid more than 1000 ml. Oligohydramnios means insufficient amniotic fluid in the amniotic sac is called as oligohydramnios. Oligohydramnios is a state of where liquid or amniotic fluid is less than 200 ml is called as amniotic fluid oligohydramnios. What is the causes of oligohydramnios? Amniotic nodosum means absence of amniotic cells and IUGR, intrauterine growth restriction and retardation, and renal agency. Renal agency means absence of kidney. Next, intrauterine infections also one of the cause of the oligohydramnios. Here oligohydramnios means less than 200 ml of amniotic fluid is called as oligohydramnios. Here we can see the less than 200 ml of amniotic fluid baby means oligohydramnios baby is too little baby and also less amniotic fluid. Next, move on to question number 97. Hemorrhage at early pregnancy. Hemorrhage at early pregnancy is called as. We will see the options here. Option A, spontaneous abortion. Option B, endometriosis. Option C, inevitable. Option D, none of the above. Hemorrhage at early pregnancy is called as miscarriage. Option A, spontaneous abortion. Option A is the correct answer here. Hemorrhage at early pregnancy is called as spontaneous abortion. Here also called as miscarriage. Hemorrhage of early pregnancy is called as abortion. Abortion means extraction and expulsion of embryo or fetus. It is weighing less than 500 grams or 500 grams is called as miscarriage. It can be spontaneous and induced. Here hemorrhage or spontaneous abortion or miscarriage is early pregnancy. Here option A is the correct answer. Here option C, inevitable abortion is one of the type of the abortion, not different type. Spontaneous abortion, type of the abortion, vitable and inevitable abortion. Next, move on to question number 98. The term parasios is a Options: option A, death of mother, option B, death of father, option C, death of fetus in the twin pregnancy, and option D, none of the above. Here, a term papyrosis. Papyrosis is a term is used when IUFD, intrauterine fetal death, or IUFD, intrauterine fetal demise of a twin pregnancy is called as paraphysiosis. Option C, death of the fetus in twin pregnancy is called as papyrosis. Here option C is the correct answer. It is occurs in early pregnancy with retention of the fetus for a minimum of 10 weeks, resulting in mechanical compression of the small fetus or loss of fluid. Here option C, death of one fetus in twin pregnancy is called as papyrosis. Here we can see in this picture the papyrosis, death of the fetus in twin pregnancy. Next, move on to question number 99. Paracervical block is associated with the danger of options: option A, fetal bradycardia, option B, inhibition of labor, option C, increased loss of blood, and option D, autonomy of uterus. Current evidence suggests that the most likely reason for fetal bradycardia is reduction of uteroplacental perfusion due to the uterine artery vasoconstriction, and other common complication is fetal scalp injury, also one of the complication during the paracervical block associated with danger of the fetus bradycardia means decreased heart rate. Fetus heart rate is decreased means fetal bradycardia. Option A is the correct answer here. Next, we will move on to question number 100. Herpes genitalis is causes. The herpes genitalis causes is, we will see the options here. Option A, chylocystosis in smear. Option B, atypical cells. Option C, carcinoma of cervix. Option D, sterility. If women become infected herpes genitalis in the last 3 months of pregnancy, the virus is passed on the baby in about 30 to 50 of 100 births. Herpes genitalis is common sexually transmitted infection caused by the HSV simplex virus. HSV means herpes simplex virus. This is the one of the cause of herpes genitalis, and also carcinoma of the cervix also one of the cause of herpes genitalis. Here the causes of herpes genitalis from the options: carcinoma of cervix, option C is the correct answer. Due to the herpes genitalis causes to the fetus, here we can see the blisters due to the congenital herpes. We can see the all over the body. This is one of the pic in the one of the portion of the baby. Here blisters due to the congenital herpes we can see in this picture. Carcinoma of cervix is the correct answer. Herpes genitalis causes of cancer of cervix. Option C is the correct answer. This is the last question in this video in the point of view gynecological midwifery and gynecological nursing. Till now we are successfully finished midwifery and gynecology nursing point of view 100 questions, and anatomy and physiology point of view 100 questions, and nutrition point of view 100 questions. Next video we will discuss another subject from the nursing, the fundamentals of nursing point of view. We will discuss 100 questions next video. Stay tuned friends. Thank you for watching the Voice of Nurse. Please subscribe my channel, click on the bell icon for further notification. Thank you.